So I wanted to show you what the kneecap position should look like. When you're sitting, for example, or standing, this is what your kneecap should look like. This would be, the red object is your kneecap or your patella. And so when you're sitting, it should be straight inside of those, in that groove, or what we call the tunnel. And that way it allows for disbursement of force along the whole bottom side of the kneecap. That reduces the pressure, that reduces the friction and the grinding, etc. Now what will happen sometimes is that your kneecap doesn't sit in the position that it's supposed to. So your kneecap will track off to one side. And it could go left or right. But what happens then is that this sharp area from the femur starts to rub on one very specific part of the kneecap. Or this rougher edge of the kneecap starts to rub on the groove, the tunnel. And you'll notice there's no contact down here, and that's what causes the grinding, the cracking, the popping that you feel or hear when you're doing things, and it eventually leads to the pain that you feel. In this last picture you'll see basically the femur again, and what you'll see is that the kneecap is sliding side to side as you're moving, as you're walking, as you're going up and down stairs. And so you'll get friction here on the kneecap and on the femur, and then as it slides over the other way, you'll get the same thing on the other side. And again, that's what will cause that grinding, that popping, that pain, but it also causes the discomfort. These two are not normal and they're not what we want to see, but most commonly that is to some degree what we see in people that have patellofemoral pain. This is what we want to see all the time. And your knee bends and straightens so that that kneecap tracks straight up and down in that tunnel the whole time, regardless of whether you're sitting or walking, going up and down stairs, running, etc. And it allows for the disbursement of the force along the whole backside of the kneecap and no sharp edges pinching on anything the way that you see there. So when you're sitting, this is what happens. Your knee's bent 90 degrees, 60 degrees, etc. You're sitting at work, you're sitting in the movies, you're sitting at home watching TV. And instead of your kneecap staying here, where it should stay, your kneecap gets pulled up higher. And this is a place where it'll end up with pressure on it, and places where it's not really meant to. So again, you'll get that pain, or you'll get that rubbing, or you'll get that soreness that eventually can turn into other problems. Now when you're standing or you're walking and that kneecap is tracking up and down, same thing. You want it to track up and down in this space here, but what happens is it starts tracking up and down, and so now I get only a little bit of an area where that force is distributed, as opposed to along a much greater area along the whole kneecap the way that it should be. So again, you'll get this rubbing, this friction in that one little corner, and that's what starts to cause that grinding or that pain or that soreness that progresses into other problems as well. If you're having any cracking, popping, crepitus, grinding, soreness, etc. in your knee, you're experiencing some level of patellofemoral pain. There's so much that physical therapy can do to help you with patellofemoral pain. And really, it's a matter of figuring out what is causing the pressures or the tracking issues in your kneecap. That's really where an expert physical therapist at Loudon Sports Therapy comes into play. We can figure out what is causing your patella to press or rub in your femur or track on your femur in a method that it shouldn't be doing. We can then, through some manual techniques, some manual treatment techniques, change the position of that kneecap, get it tracking in the direction that it should be tracking in. Go back and take a look at what are the areas where you are tight, where you're getting that pull from muscles that you shouldn't be getting pull from. Look at your weakness and your strength. What is the balance really in that VMO and your abductors? And get those coordinated and balanced out so that that kneecap is tracking straight up and down the way that it should be tracking all the time. There's a lot of other things that we'll look at in terms of something that's called your Q angle. It tells us about the position of your foot and your hip in relationship to your knee. And we want to help you get patellofemoral pain under control, because if it goes unaddressed, it turns into things like arthritis. Long-term down the road, it turns into the need for a joint replacement, meniscus tears, ligament problems in the knee, etc. So again, something easy to take care of. Give us a call and we can get you started feeling better and doing all those activities that you want to do without any patellofemoral problem or any knee problems at all.